Sober Boundaries is designed as a discussion and information sharing platform when it comes to enjoying and having success in sobriety. The first time I saw the AA 12 Promises, I was sitting in a hospital substance abuse recovery meeting. The room had several treatment concept posters hanging on the walls in what I consider to be cheap, boring, plastic frames. I had arrived at the hospital around 3 a.m. that morning. It was now 10 a.m. and I was in the early stages of withdrawal, so I was exhausted, aggravated, and disinterested. After glancing at the information, I prayed that the hour passed as quickly as possible. I, of course, was in massive denial, and the words spoken went in one ear and out the other. It took almost 10 years and multiple admissions before my healing began. One morning in the spring of 2017, Pam, my wife of 20 years, after months of concern and research, informed me that she had found a new cost-effective health care plan for me. I remember being both indifferent and grateful, knowing how diligently my wife manages several of our family systems. As a male nurse, I have a somewhat resistant but open mind to the necessity of regular health checkups. Like most guys, the man in me dislikes doctor visits, but the nurse in me says, "Let's get it done, sir." So, over the next season, I endured a complete physical, the dreaded colonoscopy, and several rounds of blood tests. During the last blood draw, I asked my doctor, "Hey, why the visit for just a blood test?" Then with a blank stare, she said, "I think you might have hepatitis C, but I want to be totally sure." Turns out she was right. Even though I put forward a brave face, I was very concerned because Hep C killed one of the nurses that had trained me when I was learning dialysis. You know, for a hot minute, I used my dialysis experiences as a source of false ego soothing by imagining I was infected with Hep C by one of my dialysis patients. Really. The reality stepped in and reminded me of my IV drug abuse, and then that fantasy left faster than it came. The next few months involved visits to an infectious disease clinic. Fortunately, everyone in our house had regular doctor visits and were cleared of any problems with the Hep C issue. Finally, a specialist informed me that the strain of Hep C that I had was very treatable and that I only had slight liver damage. The shock came when I found out the cost of the medication. At that time, each daily pill was $1,125 a piece, and I needed a 12-week treatment. Man, that was over $94,000. As my mind drifted trying to figure out where to get that much money from, the clinic nurse said, "Wait a minute. Your healthcare provider offers a number of discounts and grants. Give me a week or so and I'll call you and let you know what's available." You know, it was really tough keeping my mind clear, waiting the 4 days for her to call me. The news, however, was incredible. My out-of-pocket cost was only $200. Awesome. You know, it was really sobering holding that first bottle with over $31,000 worth of life-changing medicine inside. During the 3 months that I took the medication, I remember while facilitating a 12-step group at work, my eyes found our poster with the 12 promises. My perspective has greatly changed since that morning years ago. I have learned that the promises can apply to drug abuse as well as alcoholism. My situation found me grateful as Promise 12 blessed my life along with the other 11. Incredibly, while facilitating some groups, I've had people admit that they were Hep C positive and that my story gave them hope. However, it seems that some insurance companies require certain periods of clean time before considering helping a client to pay for Hep C medicines. If you are positive, seek help from medical professionals because the cold hard facts are 60 to 70% will develop chronic liver disease. 5 to 20% will develop cirrhosis of the liver in 20 to 30 years. And of that, 1 to 5% will die from cirrhosis or liver cancer. After I took the last of the medication, during a quiet moment, a couple of questions concerning this miracle came to mind. What inspired my wife to select that particular healthcare provider out of the many she had researched? Also, would I have received this blessing if I had not fully embraced sobriety to include being civil to my fellow man? If you like the content on this channel, please subscribe and share and click the bell so you'll be notified of each new video. Also, please post any questions or comments as we really enjoy hearing from you. Thank you for joining us. Hope you see you next time. My name is Wade Davis. Take care.